I'd like to call upon Dr. PATHIRAGE to speak on his project titled Restructuring Screening Process of School Children for Refractive Errors. Dr. PATHIRAGE.
Good morning. Thank you, sir, for the kind introduction. My project is restructuring screening process of school children for refractive errors. As you all are aware, myopia is a global challenge, and myopia is increasing worldwide. And in 2020, prevalence of myopia in the world was 2.6 billion, which was highest in East Asia, with 51.6% of the population being myopic, and in the Europe it was 32 to 36% in different regions. An estimated prevalence of myopia in 2050 is 4.9 billion. Risk factors for myopia include both genetic risk factors like family history and ethnicity, and environmental risk factors like increased near works and limited outdoor time. So the current screening method for refractive errors in school children in Sri Lanka is conducted by the public health inspectors of Ministry of Health using Snellen charts to assess the distance visual acuity, and children with reduced vision is referred to the nearest eye clinic. So the children age 5, 9, 12 and 15 are screened with 3-year age gaps in between. That is, this gap is mainly due to the limited staff. So for example, if the patient had his first screening at 5 years, then the second screening will be done at 9 years. So after 5 years, then 6, 7, 8, there will not be any screening. But if the child develops refractive error at age 6, it will not be detected until the age 9. In the same way, even after 9 and 12, there's 3-year age gap until the next screening. So the objective of this project is to introduce an efficient and cost-effective screening method to detect refractive errors in school children. This project was conducted in Halila MOH area of Badula district, a rural area in Sri Lanka, where health facilities including health staff is very limited. The population of the area is about 600,000, about 1 million, and there are about 200,000 school children studying in 602 schools. The Halila MOH area was selected for the initial phase. There are about 13,000 school children in 71 schools. Prior to starting the project, we got the permission from the Director of Education in Badal district to conduct teachers training education programs and to screen school children. In each school, there are 1 or 2 health promotion teachers, so they are involved in the health-related issues in school children. So in the first phase, we conducted the seminar to educate school health promotion teachers of the area about the importance of regular annual vision assessment in children instead of 3-year assessments. And we emphasize the deficiencies of current screening method, and we taught them how to assess vision using Snellen charts, and provided each health promotion teacher with a Snellen chart and advised them to organize a teachers training session in their school to educate class teachers to test visual acuity in children. This is the Snellen chart we used, and it gives simple and precise instruction in local language to how to check visual acuity in children. And this is the first phase workshop to educate the health promotion teachers. And the health promotion teachers, they organize workshops in their schools to educate the class teachers about the importance of regular visual assessments and train them to assess vision using Snellen charts. Then the class teachers were advised to use Snellen chart to check visual acuity in children and refer those children with reduced vision to the eye clinic. This was coordinated by the health promotion teacher of the school. And those children who were referred to the eye clinic, they had cycloplegic refraction done by optometrist, and either senior medical officer or consultant ophthalmologist did the direct fundoscopy examination, and corneal topography and OCT scans were done where relevant. After assessment by the consultant, spectacles were given and followed-up appointments arranged, and patients with suspected keratoconus and progressive myopia, they were directed to the relevant management, specialized management. 54 out of 71 schools in the MOH area completed this project in the first phase. So 8,257 students had visual acuity tested by their class teachers using the provided Snellen charts. 986 children, that is about 12% with reduced vision, were identified and referred to the eye clinic for further assessments. Of those children who were referred, 928 students, that is 11.2%, found to have refractive errors. And 12 were diagnosed with squints, and there were suspected keratoconus in 27 children. Of those who were referred to the eye clinic, 248 children, they already used glasses, and they were followed up in eye clinic for refractive errors. And there were 128 children who were initially diagnosed with refractive errors but defaulted follow-up. And there were 59% of the children were new cases found in this screening. The myopia was the commonest refractive error, and the astigmatism was next to myopia. In conclusion, school teachers are a valuable resource that can be used in the screening school children to identify those with refractive errors. Annual eye screening in school children help to detect progressive visual loss due to myopia and keratoconus at an early stage. Annual vision screening at the beginning of each academic year by class teacher, coordinated by health promotion teachers, is necessary for the sustainability of this program. And this project was conducted in a small area, the MOH area in the Badula district, but in the next phase we are planning to expand it to the whole Badula district. That is, this project was conducted for only for less than 10,000 students, and the next step, second step, that will be 200,000 students, and finally we are planning to expand it to the national level. And this is a photograph of the Badula district, one of the famous tourist attractions, and thank you for the kind attention. Thank you.
Thank you so much. I had one comment while the teachers are being taught how to take visual acuity on Snellen's chart. What possibly can also be taught to them is how to look at behavioral patterns of children sitting in front of them, like somebody who's squeezing their eyes, or somebody who's trying to move forward towards the board.
Absolutely.
Or somebody who has preferential errors between the letter C and the letter O, similar looking letters, which could again be giveaways that these children are having issues with refractive errors.
Yes.
So I think we'll not take questions for this presentation because we are out of time. Thank you so much.